This is Reno Sparks MedSpa, and I'm Dr. Van Reken. This is the lovely Esther. I've had the pleasure of being her boss for over 5 years. And so she's easy to work on because she's beautiful to begin with. You don't really have to do anything, but she wants to be even prettier. So why not? So today we're going to do some Botox. And you can't just do Botox out of a book. And she's interested in a little bit of bunny lines, which aren't too bad, but go ahead and frown for us a little bit. So she's get this muscle here, and we can kind of relax that, and I'll be giving a little Botox along there. And then go ahead and frown for me, Esther. Now, she never really does this in real life, but we can get these weaker. And now go ahead and raise your eyebrows. Now, notice that, raise them, and, okay, notice she doesn't have a lot down here. Many people have wrinkles here and here. Her wrinkles are near the top. Now, normally I would give Botox here and here for that, but in her, because of a wrinkle pattern, I'll give it all up. And so what you have to do is look at the patient's own anatomy and decide what's best for them, because it isn't the same for everybody. And it isn't even the same in the same person from the side. If somebody's got big crow's feet over here, less over here, you would then give them more product there. So I'm going to give her about 15 units or so here. I'm going to give her about 10 units there, and I give her about 3 and 3 here. Now she has this subtle wrinkling under the eyes, not bad, but she'd like to have a little bit of less of a wrinkle there. So we're going to give a little bit of Botox there and there. Now this is an area that commonly bruises. There are a lot of blood vessels. What I like to do there is kind of put my finger down and rest the needle on it so I have control. You're right near the eye. It's unnerving having someone inject near your eye, so I use extra care. If the patient's flailing around and the kind of person that would grab my hand, forget it, I'm not going near their eye with a needle. So we'll go ahead, she's already cleaned, and I'm going to start on her forehead. And as I said, we're going to give her about 5 shots up high. Here's 1. And this is a 32 gauge needle, it's pretty small. Does that hurt much, Esther?
No.
I prefer to give small needle, and I prefer non-bacteriostatic saline. I'm sorry, bacteriostatic saline, because I think it stings a little less. I also like to change the needle about every 5 pokes. And so every 5 or 6 pokes I'll change the needle. So right here we're at 5 pokes. I'm going to change the needle right now. And that way we have a sharper needle, it bruises less. And wrinkles under the eyes or on top of the eyes are called dermatocholasis, and there are many ways to treat them. Botox is just one. So here we go, and I'm going to use my thumb and rest this right here. Here comes a poke, Esther. That looks good, doesn't look like she'll bruise. And we're going to do the same thing over here. Pull my thumb down and just be real still. That's it. And then alongside the nose, kind of feels a little stingy here. Turn toward me, dear. How you doing, Esther?
Good.
We're almost done, my friend. Notice the bumps. So we've given Botox. These are small bumps, these are larger bumps. Why are these bumps larger? Well, I gave her more product there. And so what we've done is we've given 2, 2, 2, 2, and they're small bumps, and they're going down. And then where we gave her 3 units, the bumps are a little bit larger, as you might expect. So she should get a nice result from this. So we'll go ahead and clean her up and let her go back to work. And so she's an awfully pretty girl to start with, but this won't hurt either. This is Dr. Van Reken signing off from Reno Sparks MedSpa. Stay good looking.